Waterfalls, cool breeze, bird watching and water rattling are some of the attractions here. This high-pressure water from River Rushoma signifies not only beauty but also horror. As tourists climb the steps to enjoy the view, they meet this monument that tells the dreadful story of the sub-region. Before the 1920s, it was a taboo for a girl in Kigezi to get pregnant out of wedlock. And when it happened, the Council of Elders would sit at their drinking herb and decide on the punishment. And that punishment was forcing the brother to that girl to take her up there at the tip of the falls along with the rest of the members of the community and then throw her down. And after throwing her down, she would be left there to rot as an outcast. Rare archives indicate that this practice went on until one pregnant girl hung onto the boy who was pushing her and they both fell to their deaths. It simply took a boy's death to end the backward practice.
One sister pulled the brother and they went together. And unfortunately, in the family, they were two kids then and the parents. So that means that all kids died, then the parents stayed alone.
And that's when they realized that the practice was bad, and we are told that's when it stopped. And after that, they would go to another hill for cleansing, where they would kill animals and things. And I'm told that's when they had a longer discussion and said that such a practice is bad.
So our understanding is that the brother would be the one who would push the girl, because he would have been waiting for the bride price to be received by the family so that he in turn could now go and look for his own bride. And now she's become pregnant and is not married, there will be no bride price, and so he's losing his opportunity and potentially the future.
The story of transformation, as shown in the monument, is now the primary source of income and health funding for the poor who can't afford treatment at Church of Uganda Kisizi Hospital.
Average, we've been affected by the COVID, the pandemic, but we are rising up. In revenue, we could get average 9 million, but that includes selling of other products like crafts. We also make our own products. We have coffee, we have crafts. The 9 million goes to the poor patients in the hospital who can't afford their bills.
But the patients' number remains big.
It's those people who are vulnerable and unable to pay for their health care. Whatever the specialty, it might be on children's ward, it might be mental health. Across the hospital, that fund will help those who need support.
For the humanitarian needs these attractions cater for, the managers look to increase the revenue from these ventures by making this facility a recreation center. For now, Kisizi Falls attracts about 2,000 tourists every year. Edward Muhumza, NTV.